Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for chronic bronchitis. What is chronic bronchitis? Literally, it means persistent inflammation of the lining of the bronchi and mainly of bronchioles, fine air tubes carrying inhaled air from bronchus to alveoli. According to definition of modern medicine, if one suffers from cough with mucus discharge most days for 3 months in a year, 3 months a year, 2 years in a row, the one is assumed to be affected with chronic bronchitis. It is a part of group of lung diseases called Chronic Obstructive Pulmonary Disease (C.O.P.D). What are the causes of chronic bronchitis? Number 1, smoking or second-hand smoking. Number 2, chemicals, polluted air, fumes. Number 3, repeated acute bronchitis. Number 4, asthma. On the right hand side, anatomy of respiratory systems. Anatomy of respiratory system has been shown. Please check it and know the various terms. This will be used in the video. This such as bronchi. This is bronchi, lung, trachea, bronchioles, alveoli, pharynx, etc. What happens in bronchioles in case of chronic bronchitis? Now, chronic bronchitis, see this, the normal airway. This seems like these are normal airways, and the lumen looks like this. Now here the damaged airways. This airway is damaged. This is so many cilia has been damaged. Mucus has been increased mucus secretions. Extra goblet cells has come to just meet with this excess secretion of mucus, and for excess secretion of mucus, the muscle wall is thickened and the lumen is minimized. So there will be stress for respiration because air supply is less. Please mind that acute bronchitis is a microbial, viral or bacterial disease. It comes and goes, but chronic bronchitis is a disease state produced by toxic effect of chemicals. Change brought about by this is irreversible. This is a very, very important concept. Acute bronchitis is microbial, either viral or bacterial or fungal, etc., and it comes and goes. But chronic bronchitis is irreversible. That's a very important term because this change has been affected by toxic effects of something. What are the sign symptoms of chronic bronchitis? Early sign symptoms: chronic cough, copious white yellow mucus discharge with cough, fever, chill, fatigue, and halitosis. Halitosis is bad breath. Discomforts in chest. Late sign symptoms: cyanosis. Cyanosis is bluishness of lips, nails. Bluishness. Why bluishness? Because oxygen is going less and less. To that, for that reason, the blood is not receiving enough oxygen. It turns into blue. Swelling of legs and ankles. Oxygen saturation level goes below, generally 95% or less. Shortness of breath, wheezing respiration. When to consult a doctor? If cough stays longer than 3 weeks, disturbed sleeps, is with a fever over 40.4 degree Fahrenheit, produces discolored mucus. The ordinary color is mucus is generally transparent color. At best it may be whitish, but if it becomes discolored, there is a reddish, blackish, then it is a sign of premonitions. Produces wheezing respiration and breathing problem. How to prevent chronic bronchitis? Number 1, quitting smoking or never starting smoking. Avoiding second-hand smoking. Using protective gears while working with chemicals, fume, dust, etc. Number 4, controlling stress with the help of meditation, relaxation, chatting, etc. Getting regular exercises to strengthen lung capacity. That's a very, very important part of the controlling procedures. Getting regular vaccinations against pneumonia, influenza related virus. If it is available, one must take it. Get enough lung friendly items like beet greens, apples, blueberry, pumpkin, turmeric, tomato, red cabbage, olive oil, yogurt, Brazil nut, lentils. These are all lung friendly foods. Now, remedies. Ambergris for chronic bronchitis. Excited by violent tickling evening without, morning with expectoration generally of greyish white, seldom of yellow white with sour or salty taste. Paroxysm of paroxysm of cough coming from deep in chest, worse from exertion and music, violent spasmodic cough with frequent irritations, hoarseness, in aged people. That is basically Ambergris is for aged people. Arsenicum album for chronic bronchitis. Chronic bronchitis of old people. Dry catarrh of old origin from emphysema and pulmonary congestions. Dyspnea continues during intervals of cough. Returns periodically, especially at night. Expectoration white, frothy, often sticky mucus. Worse after eating, in the afternoon, after midnight, from lying down, drinking cold water, mental exertions. Now, Natrum carb for chronic bronchitis. Cough excited by coming into warm room with salty, purulent, greenish sputa. Cough short, rattling in chest with rumbling and incarcerated flatus. Incarcerated flatus means the air, flatus means actually air, which is blocked in a particular chamber. It is knowing neither going up or neither coming down. Sulfur for chronic bronchitis. Invalid bronchitis. Chronic catarrh with secretion of large quantities of tenacious mucus. Suffocation with palpitations. Pain in chest during cough with nausea and vomiting. Heaviness in head and dim vision. Sensation of ice in chest whenever chill or perspiration is checked. That is, whenever chill and perspiration is checked, sulfur patient go worse. Phosphorus for chronic bronchitis. Subacute attacks of bronchitis in emaciated cachectic overgrown young invalids. Dry tickling cough in evening with tightness across chest and expectoration in morning. Pain in chest when coughing relieved by external pressure. Tingling, soreness and rawness in air passage with expectoration of viscid or bloody mucus. Carbophage for chronic bronchitis. Chronic bronchitis with emphysema. Great anxiety and dyspnea but no restlessness. Mind, no restlessness. Cough in violent spells. Watery, profuse discharge, breathing short with cold hands and feet. Cold breath. Cyanosis. Cyanosis means bluishness of some parts. Feel better from hard fanning over face. Badiaga for chronic bronchitis. Mucus secretion so excessive that during talking or coughing or laughing, pieces of mucus fly from mouth. Sometimes gagging and vomiting occurs due to mucus. Chronic bronchial asthma. Bronchial catarrh actually, chronic bronchial catarrh. So we are talking about bronchitis, naturally that thing. Stenum met for chronic bronchitis. Weak feeling in chest after talking or expectorating. Excessive mucopurulent greenish discharge with a sweetish taste, sometimes salty. This greenish discharge, mind this, greenish discharge for stenum met. Lobelia inflata for chronic bronchitis. Extreme dyspnea, worse from slight exertion or from short exposure to cold. Feeling of strong constriction in the middle of chest, obstructing movement. Deep inspiration is impossible. That is, patient cannot take deep inspiration. China for chronic bronchitis. Tickling cough worse from talking, laughing, with anemia, edema, weakness. Cough after chronic catarrh with coarse, loud mucus ralls and cough when head is low. So with this the video ends. Thanks for listening and viewing. Got anything to say? Please write down in the comment section. I will certainly respond.